All right, so let's talk about surgical Symmastia repair. So Symmastia, also known as uniboob, is where you lose your cleavage and your breasts touch in the middle, and the skin that normally is well adherent to your breastbone is now tented up, so it goes flat across in the middle. And so this can happen from surgery when things go awry. So in general, in my practice, I see two different types of surgeries that can lead to this. So the first one is implant surgery. So whether you're over the muscle or under the muscle, there's a possibility that that pocket or space that's made for the implant extends too far to the middle. So if it's under the muscle, it's often the muscle was over-released, and so it was removed off the sternum more than it should have been, and the implant can shift this way. The other reason why this can happen is just the surgeon over the muscle extended the pocket too far this way as well. So they're trying too hard to get the implants to touch, to get a really artificial cleavage line, and things go awry. The other place that I see this surgically created is with breast cancer patients. So it's typically the general surgeon has lost their respect for the breast footprint and blown way past the footprint of the breast, sometimes even completely crossing midline and taking the skin off of the sternum. So when I fix a surgically created Symmastia, my goal is to repair whatever was harmed in the original surgery that caused it. So if your muscle was over-released, the goal is to fix the muscle back to the chest wall. I typically do a site change, so the implant then is placed over the muscle, and this can allow that area to heal and the implant to be in a more natural location. If the surgeon went all the way across midline and separated just the skin off of the chest wall, then again, you're going to collapse the pocket, make it a bit smaller in the middle, and then get your implant in a better position, and hopefully this will heal well. Now with the breast reconstruction patient, we do our best at the time of the mastectomy to repair whatever was damaged with the mastectomy, but sometimes it's not super effective and it requires some revisions in the future. And it's the same thing. You would go back in just like an over-the-muscle breast augmentation, try to close down that medial pocket, usually use some big heavy-duty stitches that dissolve with time, and then keep the implant in a better position and not allow it to touch in the middle. And I think it's always important as a patient, if you're considering a breast augmentation, that you have an understanding of the natural footprint of your breast. And so I know everyone comes in wanting cleavage where your breast implants are touching in the middle, but that's not really a natural position to the breast. And so the chance of you causing damage and that leads to Symmastia is higher if you do that. So I always recommend to patients to respect the natural footprint of the breast. I think you get a beautiful natural breast augmentation and you don't end up with problems like this. And then one thing I didn't mention is that after a Symmastia repair, we typically put you in what's called a Symmastia bra for a while. So it's basically a harness where you have a piece of it that goes right down the middle of the chest to compress that area, and there's kind of an X above and an X below. And that helps put compression on the area of the repair for the first couple months while the area is healing. So this is a really difficult problem to solve because of the weight of the breast. It will pull your repair apart with time. We don't like to use permanent sutures, so typically these are heavy-duty dissolvable or even removable. Some people put them through the skin. I don't do that because it leaves weird scars. But this can be a really complicated problem. So it's one of these problems that's best never to have. So think about that when you are asking for certain things in your breast augmentation. All surgeons should think about this before they recommend things in a breast augmentation, and hopefully that answered your question.